Now to the fight against COVID-19 in Georgia. Governor Kemp issuing two new executive orders. His first one extending the public health state of emergency through August 11th. He says a spike in new cases and hospitalizations played a huge role in his decision. 5 times over the past 10 days, Georgia broke the previous state record for new cases, including those set in April. The second order continues to require social distancing and bans gatherings of more than 50 people if they can't maintain social distancing. The order also expands shelter-in-place orders for people in nursing homes and the medically fragile. The governor extending these guidelines through July 15th, so for 2 more weeks. Right now, we know our state is one of about 30 seeing a surge in infections, and part of that is more people are getting tested. Many say they want to get tested before going away on a trip, but it's not as easy as it sounds. Nick Sturdivant is live outside the state capitol with more on how some people are having a tough time getting a test. And Nick, this sounds oddly familiar to the stories from back in March and April.
Yeah, that's right, Sheba. Good morning. And as you mentioned, the demand for COVID-19 testing is rising. And yes, we have gotten reports of some people waiting in line for hours. Take a look at your screen. This is video that we received over the weekend. A viewer sent us this. It shows a long line of people in their cars waiting to get tested for COVID-19 in Sandy Springs. It was all to help the Latino and Hispanic communities there. The executive director for the location said she believed part of the reason for the lines was that no appointments were needed and it was over the weekend. Fulton County Health Director Dr. Lynn Paxson suggests you call to make an appointment ahead of time. Dr. Lynn also said that the county is making changes to its call center.
We've had a lot of complaints about people not being able to get through to our call lines. And so what we're doing with that is we are actually moving our call center to a different location. So we'll have more people available to take those calls.
And for everyone out there that is looking to get tested, testing is free. You do need your ID. However, you don't need your social security number.
All right, Nick, we got it. We're still learning more about the COVID-19 symptoms and the ways the virus attacks the body. The CDC recently adding congestion, nausea, vomiting, and diarrhea to its list of symptoms. The last time the Atlanta-based agency updated this list was in April. And according to the New York Times, patients in the ICU are also experiencing extreme nightmarish visions. The condition is called hospital delirium, normally seen in older patients, sometimes with dementia. But now this report says it's affecting up to 3/4 of ICU patients, no matter their age. The first drug shown to be effective against coronavirus is remdesivir, and doctors say it shortens recovery time for severely ill patients by a couple of days. And now it has a price tag. Francesca Amaker joining us live from her home in Fulton County with a breakdown of the price and what people are saying about it. Francesca.
Oh yeah, Sheba. It's being reported that this drug actually received $70 million worth of taxpayer money and should be considered a public domain. But according to the company's CEO for Gilead Sciences, it cost them $1 billion to develop. But again, a lot of people are talking about the price tag that just dropped yesterday. Listen to this. So for those covered by government health programs in the U.S. and other developed countries, it is priced at $2,340. And now it will be $3,120 for patients with private insurance. The amount that you pay out of pocket is going to depend on your insurance and other factors. Now, those prices have been criticized for being way too high. So the CEO of Gilead Sciences says that we're in uncharted territory with pricing a new medicine, a novel medicine in a pandemic. And he goes on to say, we believe that we had to really deviate from the normal circumstances here. So here's what you all are saying about those circumstances and those prices on Facebook. Sandy Hampton says the real evil in this country is big pharmaceuticals who only view sick people as their cash supply. And Ann King says our government is going to sit by and let this happen. They're not going to do anything about this. Linda Stitley actually commented and says, sounds like a ripoff to me. Companies who make this medicine should be regulated to keep prices down. And that one got a lot of likes. Now, if you're curious, Gilead will actually continue supplying hospitals with this drug until September. But Crash, I know we were talking about it during commercial break. Here's the gag, and this is what a lot of people are pointing out. 127 poor countries are actually being allowed to receive a generic version of this drug by Gilead Sciences, who signed off on this. And again, it's at a fraction of the price. So why is it so expensive here in America? We're always seeing these high drug prices.
Yeah, that was going to be my question to you. Let's see how other countries are handling this. And you just gave a perfect example. In fact, another example we had not too long ago with people with insulin prices going through the roof. People were going to Canada. They were going to Mexico to get it just to survive. I mean, it's amazing, especially in a global pandemic, that you do see these pharmaceutical companies, some of these bigger ones, that all of a sudden here's something that's going to help, and all of a sudden the price is through the roof. Okay, yes, some can afford it, some with insurance, but for the most, especially with 50 million people unemployed, come on, there's got to be a better solution. Sheba.
I think bottom line, if you're being treated for COVID-19 at the hospital, it is going to be an expensive hospital stay. Yeah. It is 6:37 right